Well, I'm Sam. I'm one of the lucky med students that studies with Yong here. Oh, watch the guitar, watch the guitar.
Yeah.
Oh, mate. Yeah, I'm Sam. I'm a med student here from Geelong, but moved around a lot, so I'm rural as well. What else do you want to know?
How is med school like for you so far?
Oh, it's pisser. Nah, it's great fun. It's great fun. I mean, we're only 10 weeks in, 11 weeks in, so, you know, learning a lot. Placement is great. I mean, we're pretty lucky to be here, so I can't really complain.
What do you mean by a lot? Give us an idea. What are you learning?
What are we learning? That's a great question. We're currently studying respiratory block, so that's the second of our systems that we're looking at. We've just finished cardiology, or the cardiovascular system broadly. Not too much depth on each, but, you know, like a good overview, you know, of the most common stuff that you'd come across when thinking of diseases or, I don't know, any kind of condition, cardiovascular related. So, you know, really just getting into the swing of things still. Now starting respiratory system, so lungs, breathing.
Anything you found interesting thus far?
Oh, mate, not really. No, it's all interesting. I reckon cardiology's been it was a good one to start with. I reckon. I'm not a fan of. Oh, we did a foundations block with the immune system. Not a fan of that. But give me cardiology any day. It's good fun. I suppose it's still pretty early, so we don't really, you know, just doing systems is fun. Just looking at anything in specific is interesting. Learning about the physiology of it. So,
a lot of people talk about volume being really crazy in med school. How do you handle that?
I disagree with the question. No, it is a lot. I reckon it's a lot if you've never done it before. I'm lucky. I've come from a biomed background, so a lot of this is familiar, or I mean, I've at least seen it before. It's not like it's the first time I'm coming across this. So it is a bit of work, but I think it's easy to. If you're focused and if you do it, you can stay on top of it. Not too bad. And I mean, they give us so much. There's so many resources available, and there's so much help and access available. So, you know, it's all manageable. It's not like they're mean. It's not like they're just bombarding us with content left, right, and center, trying to make us fail. You know, it's presenting it. There's a lot to learn, of course, but you know, they've kept it pretty manageable. I reckon I haven't found it too bad.
How do you study? Because that's a bit of a challenge to a lot of people in terms of getting organized, having lab outside medical schools, and then having to study. And although you disagree, the volume is still huge. So how do you study? How do you keep on top?
Yeah, not very well. I wouldn't say I'm like the definitive guide to studying. Like, you know, I think I'm a firm believer that, you know, whatever works for you is what you should be doing. You know, there's no one right way to study. It's just do whatever helps you learn, and, you know.
So how do
that? So for me, I mean, I think the first thing is just know what you want to do. So I'm not aiming for 100% on my tests. I'm not trying to be perfect. I'm just trying to learn and understand a good overview of whatever we're getting at, so I can understand and apply it in the workplace. So for me, I mean, we have three classes, three main classes. So there's like a case study, the lecture content for the week, and then clinical skills and, you know, actual workplace stuff. So the workplace stuff, you just learn by doing it. I mean, we have placement once a week, so get to go into a clinic and actually do the stuff, you know, give someone an injection or take their blood pressure, and that's the only way you can really learn that. The case studies are very interesting. The way they present that is you get a week to look at it, so in the end you just look at the content, read it through, we all discuss it as a group, and then you just, if you have any queries or something, you can go and investigate that further. I know this week I've got to learn about asthma because I have no clue about the patho behind asthma, but I'll look that up, of course. And then with the lecture content, I mean, I take a very blasé approach to that. You know, I go through the slides and pick out the key information that I think I need to learn, and, you know, I mean, if you're looking at this video, I'm sure you've looked at lots of medical resources. So, things like Osmosis or Ninja Nerd, I'll, find whatever I can that explains it the best to me. Once I've got it in the old noggin, once I understand it, chuck it in Anki and forget about it. Well, don't forget about it. Do the exact opposite of forget about it, but that's...
What's Anki?
Yeah. What's Anki? Oh, what is Anki? Oh man, I'm not the person to be talking about what is Anki. It's a flashcard program. It's pretty useful. I highly recommend looking into it yourself because I can't explain it very well. But it's very useful. It's basically a way that you can just make sure that you're not forgetting anything. It's a way to never forget. It's a way to never forget anything.
Nice.
It's very useful.
What do you do outside med school?
Oh, lots. Lots. I mean, yeah, like that's one thing. I've got a lot of free time. So I play musician. I've got this in this very room. There's about 3 guitars, an amplifier, and all my cables and pedals and stuff. I'm real getting into that. That takes up a good amount of my time. I like to read. I like to PlayStation 5. So that I've got lots of little side projects, little hobbies that I like to. Just whatever I can to keep myself entertained. Really, it's not.
If
Nothing
a young person in year 11, year 12 is watching this and they really want to study medicine, what advice would you give them?
Oh, go for it. I mean, for me in year 11 and 12, I had no clue what I wanted to do. I just bloody bummed around and did whatever I was told. So I reckon if you actually think it's interesting or if you want to work towards it, go for it. There's plenty of ways to do it. I know in this course we have people from every different background. I mean, I did it one way. I went through biomed, which I'm sure is probably the most typical of the ways in. But we have nursing students, we've got pharmacology pharmacists, we've got paramedics. There's a vet in our course. There's so many ways in. So I think it's my advice to anyone that's still at high school is just follow the fun. Just do whatever you're enjoying. Don't stress about trying to get into any course or worrying about. Just do whatever you like, and eventually you'll find something that leads you down a path, and eventually you might get. If it's medicine, then you'll get to that. You'll find your way in, no matter how hard it is or whatever you have to, how many hoops you have to jump through. And plenty of maybe you study medicine, you go through it and you realize it's not for you, but you just follow whatever you like and you'll get there. It's not too bad. It works for me.
Any exciting movement and any dull movement or dumb moments while you were in med school?
Never. No, it's great. I love it.
Liar.
I'm not the person to be talking. I've had no problems. It's great fun. I don't have down moments. I'm in denial. No, it's great. I don't know. The whole thing is great. I think it's really enjoyable. We're all living together. It's great fun. The course itself is great fun. Sure, if you're struggling or there can be stressful things around tests. I know we have our first assessment coming up next week, and that's probably raised the stress levels of everyone a little bit more. But it's all part of it. You take the ups and your downs. You just.
But this is how you choose to study.
Yeah, we knew what we signed up for. It's not bad. Don't if someone's telling you it's bad, it's not bad. It's not even. It's really fun. It's the fun way outweighs the negatives. Way outweighs the negatives.
Nice.
Nothing beats it.
Why do doctors always wear stethoscope? That thing you put on your necks. Is it just to show off?
This bad boy. This bad boy. It does have a purpose, believe it or not. Besides making you look just really, really cool. No, it does have a purpose. I think as medical students, there's no reason we need to be wearing it. We just wear it because it feels fun to wear a stethoscope. But of course, it is a very valuable tool. So for listening to, we all think of listening to the heart, but we also listen to the lungs or, listen to bowel movements or anything like that. It is a tool. It has a place. It has a purpose. Do you need to be wearing it around your neck all the time? Probably not. But is it fun to do so? Yes, it is. Yes, it is.
Sweet. That's it for me. Any last comment or anything?
Dang it. Sweet.
Nice.